Hi everyone, my name is Yanling. This video is regarding a presentation of assignment for medical imaging course. So the content in this video are taken from different sources and the reference will be displayed at the end of the video. My topic will be talk about the application of CT for renal stone that being used in clinicals. Before I go into details for application of CT, let's figure out what is CT. CT stands for computed tomography, which use a combination of X-rays and computer to create a direct imaging. Normally, CT is used for differentiation of soft tissue structures such as liver, lung tissue, and fat. CT not only can reveal the presence of tumor, but also able to know the size, spatial location, and the extent of that tumor itself, because it can produce more detailed image than a regular X-ray radiograph. So what are the working principles of the CT scan? The CT scan uses a narrow X-ray beams that circles around one part of your body. Then it will provide a series of images from many different angles. A computer uses this information to generate cross-sectional pictures like one piece in a loaf of bread. This two-dimensional scan may show a slice of your internal body. This process is repeated to produce a number of slices. After that, the computer stacks these scans one on top of the other to create a detailed image of your organs. The computed tomography of abdomen and pelvic has become the first line test for evaluation of renal calculi in patients with acute flank pain and suspicious of urolithiasis. Renal stone or renal calculi defined as the formation of stone in the kidney, which also called it as the kidney stone. For your information, the development of stone is related to decrease in urine volume or increased excretion of stone-forming components such as calcium, oxalate, cystine, xanthine, and phosphate. Usually, the stone forms in the urine collecting area at the kidney, and it is varying in size from tiny to as large as a ping pong ball. The symptoms of the kidney stone including the presence of blood in the urine, and you may feel some pain at the abdomen part. The recent advance in computed tomography have improved the radiological evaluations of renal stone disease. With the available of dual energy computed tomography, it is possible to determine the in vivo compositions of renal stone, assisting with diagnosis and treatments. Have you guys heard about the dual energy CT before? The dual energy CT is a new computed tomography techniques that use two separate X-ray photon energy spectra by allowing the interrogations of materials that have different attenuation properties at different energies. There are many types of the dual energy CT. For example, single source dual energy CT use a scanner whereby a single tube alternates between the high and low voltage. Another type is dual source dual energy CT. It is a scanner that consists of two X-ray tubes that mounted orthogonally, which operate at two different voltage such as 80 kVp and 140 kVp, that allow for acquisitions of dual energy images without the need for rapid changing of the tube currents. The types of the CT that used to diagnose the renal stone is depends on the conditions of patients and the availability of the machine in the hospital. The dual energy CT allows for enhanced determinations of material compositions by comparing the attenuations of the material at different X-ray energies. Besides, this technology is not limited to differentiate between the stone types, but it can also use mathematical algorithms to identify the iodine in the acquired images and remove it to create virtual unenhanced images. This is because when the image using the dual energy CT, the renal stone will show the different attenuation values at different X-ray energies depending on their compositions. So the value can then be applied to a lookup tables to estimate the stone compositions, which is a technique that has been validated with laboratory for evaluations of the stone composition. The dual energy index is calculated using a mathematical formula that incorporates the attenuation values from the examinations. It is used by the software to generate a color-coded map as shown in the pictures. For example 1, the image shows the characterizations of renal stone using dual energy computed tomography. A is the axial non-contrast CT image, which shows a calculus at the upper pole region of the left kidney. B is the post-processed color map that shows a calcium-containing calculus in the left kidney, and it is colored in blue. And next, the picture in C represents a dual energy plot which confirms the composition of the stone. The example 2 also represents characterizations of kidney stone using dual energy computed tomography. A is axial non-contrast CT image, which shows a small calculus at the mid-pole region of the right kidney. Post-processed color map in B showing a uric acid renal calculus in the right kidney, which colored in red. The picture in C shows that dual energy plot confirms the composition of stone is uric acid. The ability of CT allows doctors to identify the compositions of stones, which offer the potential for treating physicians to customize therapy based on the crystalline composition. For special case, some patients may be suffer from recurrent episode of renal calculi where the multiple follow-up radiology study is required. So it is important to note that the cumulative radiation exposure needs to be considered. In CT in follow-up examination, the amount of radiation used must keep as low as possible, and at the same time it is able to produce an adequate imaging based on the RRR principle, because this is to ensure the radiation dose are kept to a minimum. The advantage of using CT to diagnose the renal stone is the additional benefits of more precise anatomy localizations of the urinary calculi over the conventional radiography or the ultrasound. For example, the left picture shows the diagnosis of renal stones using ultrasound, while the right picture is obtained from the CT scans. When comparing both modalities, we can observe that the CT image is clearer than the ultrasonograph, because sometimes the small stones, particularly those less than 5 mm in size, may be difficult to detect on the ultrasound. Next example, we compare the conventional X-ray with CT imaging. We observe that the regular X-ray radiograph may miss small stones or some stone overlying the bony structure. However, they are readily demonstrated on CT, which will show every single slice of the organs. The CT imaging can provide the information about the composition of the stones based on the attenuation value. So the attenuation describes the density of an object encountered by the photons that passing from the radiation source to the detector, which can be measured by the Hounsfield unit, or in short form we call it as HU. Unit of a stone can indicate the types of the stone itself, because different stone composition may absorb different amount of radiation. For example, the CT density value for uric acid stone are typically around 200 to 400 HU. For calcium oxalate stone are around 600 to 1200 HU, while the calcium phosphate stone are around 1200 to 1600 HU. The CT attenuation can be used to predict the responsiveness to the shockwave lithotripsy, because it helps for destructions of kidney stone effectively. Accuracy of CT is an important characteristic when imaging the obese patients. The accuracy of the CT is generally better than the ultrasonography, because the CT has more sensitive and specific over 95% of diagnosis of renal stone. Limitation of CT is cost. For example, the cost of performing the CT scan is approximately double than performing a renal ultrasonography, because of the high technology of the CT system such as dual energy CT. Next, the radiation exposure is an equally important consideration. This fact is important in patients with kidney stone, who tends to be young, where the stone formers tend to have their first stone between the age of 20 years and 40 years. However, the stone can manifest at any age. If there are multiple recurrent stone events frequently over their lifetime, so the dose will definitely additive to a person's lifetime. Hence, the advance in reconstruction of CT information into images have played an important role in the drive to decrease the radiation dose. For example, the use of newer iterative reconstruction algorithms, including the statistical-based and model-based reconstructions, may allow for radiation dose saving in the range of 25%. Overall, the CT shows a highly sensitive and specific techniques for imaging the stone in patients presenting with renal colic. So, CT scan frequently used for clinical imaging tests to confirm the diagnosis of renal stone due to its superior anatomical details obtained. For the limitation of the CT, including the cost and the radiation exposure, which can be somehow overcome by using a low-dose protocol. Thank you for watching this video. I hope you guys learned something